Music therapists in other parts of the country are employed full-time by hospitals, by hospices, by nursing homes, by schools, by behavioral health centers, addiction treatment centers. We also have started, and we have a strong foundation in psychiatric treatment. And so a lot of music therapists started in inpatient psychiatric facilities, and there's still some that work. Music therapists have worked with prisoners, and there is some of that work out there. We work with young children in early intervention settings, and so it's really just a variety of populations because music is universal and it doesn't rely so much on verbal processing and verbal interventions. It's very easy to use with most populations. So music therapy helps with differing health conditions. So it is a therapy, so it does address health and mental health needs. So we're trying to work on specific goals. So for example, pain management, decreasing anxiety. Sometimes I'll work on decreasing heart rate through the rhythm of what I'm playing. If that's adding to their condition, their health condition, and making it worse. And so we work with adults and children basically on whatever they need to get out of life. If they have a special need and they need to work on social skills, or if they just need some more self-confidence, self-esteem. So we work with all ages. I work with hospice patients. And I just try and address whatever their needs are. So sometimes it's just listening, sometimes it's being an active participant in writing a song or playing an instrument, and that's also in hospice, is throughout all populations. So any kind of music can be used in music therapy. It depends on the client's preferences and what they enjoy. It also depends on what the goal is, and so we'll try and strategize to use different types of music for different purposes. So if the person really is very agitated, but they enjoy classical music, we might not use classical music at first. We might try and orient them to the situation, for example, if they have Alzheimer's, with live music to orient them to a here and now orientation. And then maybe add the classical music at a low tempo later on. With the youth is something I'm really excited about, is using electronic music and hip hop and just the music that the patients love. I use a variety of instruments, and now with the electronic age and the internet age, it's really easy to access any kind of music that the patient enjoys, and we can adapt it and make it more relaxing or more stimulative based on what they need. So it's more difficult in a group setting because you're trying to address a big group of people, but it depends on what the goal is. And so I don't always use older songs with seniors. Sometimes I use a modern song just to get their attention or to add interest, to stimulate their thinking. But we do use the person's coming of age music a lot because that's what people really have strong positive feelings towards, and so that's something I research and try and incorporate. But I try and use a lot of different music for our clients that I serve. Some of the techniques I use, for example, for folks who are in a comatose state or have developmental disabilities and have little verbal abilities, is vibrotactile stimulation. And so I'll take an instrument and play it on different parts of their body. With the hospice, I don't often do that, but with the adults with developmental disabilities, I do that to bring attention to cause and effect, to move their eyes to a source of sound, as those are cognitive skills for them. I have used drumming before, where it's just you put the drum close next to the client and then they can feel the rhythm. But often it's a very strong sensation, and so it has to be with the right client at the right time. Some other techniques I use are improvisation, where you structure the experiences so the client can create and recreate music. And then you do that in a way that addresses the goal. So for example, if a client has autism and they have inflexibility in their choices, you provide them structure, which is something they need, but then encourage the flexibility. For example, providing multiple xylophones to play, or changing the key of the song, adding accidentals to change the way the music is flowing. And so that's another technique. It's really individualized. A lot of time with mental health populations, I use songwriting and lyric analysis. And so we talk about the different themes and elements in the song, and then try to resolve those elements through creating a song which represents like their identity and how they can cope and recover from different challenges or resolve to make a difference. Sometimes it's just listening to me play and just relaxing to music. So it's very different. A lot of times, like in the medical field, like with hospice or in long-term care settings, there's so many noises around with and lots of medicines that they're receiving, and so I try and do things that are more calming, and will reach that person kind of in their in the kind of autonomic processing area of their brain. So one of the things that makes music so different from other ways of interacting with the world is that it's perceived all over the brain, whereas language is just in one area. And so when folks lose those language abilities, or and folks who have autism, who have trouble with language, it's difficult to, provide different interventions. But as music therapists, we're really trained in how to do that. And so I would just address if it's improvisation, if it's singing a song, if it's just repeating kind of a stanza to help them feel calm. I've embedded non-musical information in music to help an Alzheimer's patient know that they're okay and they're at home, because they always think they need to go home. In hospice, singing what that patient needs to go on to the next stage to them. So some folks, there's an incongruence with their dying process, and so I'll try and address that in a very non-intrusive way by singing to them what they need, or just singing chords to help them relax and help the body relax. So I try and match where they're at a lot of time in hospice with their breathing rate and their heart rate, and then slowly taper that down. And another way of doing that is adding the sounds of the environment. So if there's a beeping of a monitor, adding that into the music and then fading it out. Because our goal is to fade out the intervention so that person can continue basically feeling well or better after we leave, since we're only there for a short amount of time. It is difficult because the more you see the client, the more progress they can make. And so that's where, paving the way and help advocating for music therapy is so important, that folks, let people know that services are available and this is what the term means. And so I have seen clients where I haven't seen them for almost a year because of a situation with their health or whatever it may be. And then they come back into the structure of my session and they immediately respond, whereas before they would not respond at all. And so they become acclimated to me as a therapist, and that's what's unique about music therapy, is it's a therapeutic relationship. So you have that relationship and you understand where boundaries are and communication styles and different things I might try with the client, and you get used to that. And so that becomes like a safe haven for working on emotional issues, or for trying to heal from trauma, or trying to heal with dealing with dying, not necessarily healing, but coping with what's going on. So that have been some of the significant moments. It's just kind of a lot of maintenance of in the medical field, maintenance of skills and maintenance of going back to that place with that client. So bringing up words that they're not able to, they don't know where they are, they don't remember much, but I know that they know that song, and I'll sing it to them, and then I know what words to leave out, and then I'll challenge them by leaving more words. There's just a lot of significant in the literature, in our research, progress shown as sessions continue because of that foundation of a therapeutic relationship, and because there's just a big array of techniques that I can use. If they're playing an instrument, or if I'm playing an instrument, I can change the instrument timbres, and that addresses different needs. For example, if I want to reach someone and they're having a lot of intense problems and they're like an intense personality, then I may use like a buffalo drum to try and slow that down. And so you know that because you've developed that relationship and you've gone through the process of assessment, treatment planning, looking over where things are going and progress. You would Google music therapy, this is the standards that they have to meet. So having a bachelor's degree. So it's not just a weekend training program. Having an internship, which lasts 6 months, that's supervised and graded. And then taking a national board certification exam, which is not super easy. So there's a training, and you know what you're going to get when you call up a music therapist and when you call something music therapy. And so that's really important to discriminate the difference, because it leads to confusion. Since there's a lot of, the term therapy is used a lot in different ways. And so that's what a board certified music therapist is trained in. They're trained in psychology, we have to take anatomy, and then we're music majors, and we have to learn a variety of music and how music affects the brain. So that's really what a music therapist is using the music to address communicational, social, emotional, and cognitive goals. So it's our job to track progress and see if our treatment is effective. And if it's not, then we have to reevaluate and try different approaches based on our knowledge. And part of our licensures, we also have continuing ed credits. And so we have to stay up on current research and practices and ethics as well. So I'll spend a while going a little faster, and then I'll slowly take the tempo down. Take a nice deep breath. And again, I'll slow it down, and I'll take away some of the verbal complexity or the melodic complexity. Do and I'll let the client know other things that they need to know based on my assessment. If they need to know that they can be confident in their abilities, etc. And then I'll end the relaxation. So that's some of the techniques I do with pretty much all the clients. With the a lot of the folks, seniors, I'll do something like, don't sit under the apple. And then we'll work on tree, the word recall. And so then that helps maintain their memory skills, and also gives them a sense of that they understand what's going on. So that's a very frequent one I use a lot. And then I use that same intervention with kids with social skills. And so I'll teach them a song to help them remember how to do a certain skill. So like, when I have a problem, I look at the facts, know in my head, then I decide. So the steps to solving a problem. So I use that with all of the folks with special needs or with teenagers. So that's some ways I use my guitar.